Okay, so we're back. We're back, and we are here to dive a little bit deeper into the idea of cholesterol.
Mm-hmm.
And we're checking into the concept of cholesterol as it relates to a marker that we are trying to decide, is it worth monitoring or not monitoring, as we are supporting our clients in the healthy aging process. So brain health, we want healthy memories and healthy functioning brains as we age. And I, because I'm a little bit older than you, I want to have good memory and I want to be sharp and on my game until I'm 100.
Okay.
And so what am I going to be doing to get ready for that? And then I want my heart healthy and vital. And so cardiovascular disease and brain health are two of our healthy aging targets. Okay.
And so cholesterol itself, again, last time we talked about how it's not bad, but it can be bad when it's involved in the process of atherosclerosis. And that's when cholesterol makes its way past the wall of the artery and it starts to deposit. Usually there's a bit of an immune response that's involved, and then it becomes oxidized and it stays there and makes room for more cholesterol, and this can build up to be a bad thing.
And it also involves inflammation, right? So when you talk about oxidization and inflammation, and this is something that we focus on quite specifically in terms of the inflammatory response throughout the whole body. But as it relates to the health of our arteries, we don't want them inflamed as well.
No, certainly not, yeah.
Okay, so let's talk about HDL, LDL, and triglycerides, because if you've been to see your doctor, that's what they're testing. So let's define them today.
So you'll get HDL-C measured, you'll get LDL-C measured, you'll get triglycerides, and you'll get total cholesterol measured.
Right.
Now, those things worked pretty well. We found out how to basically do those in the 1940s, and they were a better predictor than we previously had. So they worked really well for a while, but now the evidence is such that LDL doesn't really matter as much as we thought that it did.
And just to interject, LDL is oftentimes purported as the bad guys.
The bad cholesterol,
okay,
yeah.
So
Whereas
they're the bad
HDL
guys.
is the good
cholesterol.
cholesterol.
Yeah.
And there's even stories to say that HDL itself isn't as good as we might think, and it gets kind of complicated. But if we were to boil down what we currently know, I would say that what matters the most is the particle size of LDL, which is the number of LDL molecules, which isn't something that's tested on a standard panel.
Okay, so we'll get into that. But for this particular video, let's define what HDL means, what LDL means, and what triglycerides are.
So we'll talk about the lipoproteins. Lipoproteins are basically these shuttles that move cholesterol around our body. Brings it to tissues that need it for making those hormones like we talked about.
Because cholesterol is good.
It'll bring it back to the liver so that it can be recycled.
Yeah.
Basically, they're the shuttles. So cholesterol itself isn't water soluble, it's fat soluble, so it doesn't exist in the blood very well. So it needs these proteins to move it around, basically.
So they're kind of like, we're going to use this analogy of dump trucks, right? So LDL drives a certain type of cholesterol around, HDL drives another type of cholesterol around. And what is the difference between triglycerides and cholesterol?
So triglycerides are not quite free fatty acids. They're free fatty acids that are bound up to be triglycerides. So they're almost a more storage form of just free fats.
Okay, so tri would mean 3, and glyceride is?
The backbone. There's a glycerol backbone that attaches those 3 fatty acids.
Yeah, so glycerol is different than cholesterol.
Very much so.
Okay.
Yeah,
okay.
Very
So
much so.
triglyceride, so when you get your blood work done, you're going to have a measurement for triglycerides, which is different than cholesterol.
Yes, triglycerides are just fats, whereas cholesterol, think of it as a pre-hormone. That's probably the best way to think of it.
Okay, perfect.
Yeah.
Okay.
And so LDL's job is to move these things around. Now, LDL also has the proteins on the outside of it that are very, very good at making it, pass through the wall of the artery and into these areas, these subendothelial spaces where it doesn't really belong.
We don't want them there.
No, you don't want them there.
No.
HDL not so much, and it gets a bit more complicated than that, but simply put, that's why LDL is considered the bad cholesterol.
Okay, because it has the ability to drive the cholesterol through into a space where we don't want them.
Correct.
Okay, so they're kind of treading on territory where they're not supposed to be. Let's stop there, and we will follow up with a sort of a recap on the difference between good, bad, and total, because we haven't even addressed total. So we're going to address total next. And then we're going to get into what is the value of even measuring these things.
Yeah, absolutely.
Okay?